Thank you all for coming today and listening to our presentations. It does mean the world to us to be able to be here and talking with you. And I love the support and the conversation between all of us as a group, because oftentimes, you have great knowledge, personal knowledge of what has helped you, and that makes such a difference for others. And so I really appreciate any questions or interjections or ideas throughout my presentation today. My background was as an oncology nurse, and I was an infusion nurse. And I would say that I was a very great nurse as far as knowing what you were going through during treatment, during chemotherapy, that active phase of initial therapy, or during recurrence, the chemotherapy phase. And I thought I had it all together about what you were experiencing. And I remember in our clinic we would, people would be done with their cycles of chemotherapy. They would have like a graduation day. And we would clap for them. I'd be so excited for them to be done. And but I distinctly remember some people not being, having mixed feelings about being done with their chemotherapy. That the recovery phase going forward was still a very long process. And the fears and the anxieties related to that. And so in my new role as a nurse practitioner in cancer rehab, I've really, more fully understood what it means to have cancer, to go through that acute phase of treatment, and then also through that long recovery phase. And it certainly takes a long time. And in our program, I am very honored to be able to help people throughout their recovery and throughout the years following their cancer treatment and through their survival. And one of the things that certainly is upsetting that can happen with cancer treatment is lymphedema. And we hate lymphedema. There's no easy way around it. But I hope today to help describe the lymph system for you, give you a better understanding of all the things that can contribute to edema, because not all of us have just the lymph system to worry about, but there's also vein disorders as well. Talk about the risk factors contributing to the development of lymphedema. Talk about risk reduction ideas and recommendations, and then talk about treatment options, and talk about activity and exercise and different things that you can do in the setting of lymphedema. So just to go over the brief anatomy of our vascular system in our body and how it works. So the main system in our body that most people are more familiar with is the heart system, the cardiovascular system. You have this big heart that pumps blood out through the arteries, delivers oxygen and nutrients to our tissues and to our organs through these tiny group of little vessels called capillaries. Then the blood travels back through veins up back to the heart. 90% of our body's fluid actually remains in this system here. But there's 10% of our fluid that kind of stays out in the tissues, kind of that space that's buffering our organs and our tissues. It's called the interstitial fluid. That's where the lymph vessels are in charge. The lymph vessels are very close by to the arteries and the veins throughout our body. But these lymph vessels are in charge of that extra fluid there. They're in charge of regulating proteins that our body is using, not using anymore. They're in charge of regulating dead skin cells, things that our bodies don't need anymore. They also, again, going forward, I'll talk about their immune function. So these vessels then travel to lymph nodes, and the lymph nodes are the filtering stations. So they trap that fluid, dead skin cells, trap bacteria, trap cancer cells, and clean that fluid up so that it doesn't travel to the rest of the body. So again, purpose of the lymph system, returning proteins to the blood system, kind of regulating that, balancing those proteins, remove excess fluid from the body. There's actual fat transport. It's called chyle that's in the intestines. There's some of that happens in that lymph function. We don't talk about it as much. And then there's the immunological functions. So The lymph vessels and the lymph nodes trap that bacteria, and they activate the immune system in those lymph nodes, and then the immune system takes out, that's where they activate the natural killer cells, the immune cells in our body. And they also, again, the lymph nodes do their job. They trap cancer cells. Here's a map of the lymph system in our body. So we have tiny vessels. We call them, they are superficial, so they do exist pretty close to the skin layer. These lymph vessels then travel to lymph nodes in different regions in our body, and we're kind of organized and separated into quadrants. We have lymph nodes in our neck, under our arms, in our groin, and in our pelvis and our deep abdomen. So we have about 50 to 100 lymph nodes in the pelvic and abdominal region. And again, if you kind of think of it as we're separated into quadrants, we're kind of split down the middle in our midsection here, and then split about at our line of where our belly buttons are. And so if you have the lymph nodes in that region are in charge of that the closest limb. So if you have lymph nodes removed under your right arm, it affects your right, under your right armpit, it affects your right arm and that right upper quadrant. If you have lymph nodes removed in the pelvis, they can affect the both of the legs down below. Good distinction is if you have lymph nodes removed in your pelvis, it does not cause you to have a risk of lymphedema in your arms. So sometimes that's a question. So there are a lot of different factors contributing to fluids and swelling in our body. There are other things besides lymphedema that we have to take into consideration. Increased capillary hydrostatic pressure. That's kind of a long statement there, but things like congestive heart failure. If your heart pump isn't pumping effectively, your body's not able to manage that fluid as effectively, and you can get backup. Blood clots in the veins can cause pressure in the vein system and cause a backup of fluid distally to that blood clot. Inflammation, when we have infection or wounds, it brings about the immune response, which includes those white blood cells that are fighting infection, but that also brings fluid with it. That's a normal response. There can be situations if there is poor nutrition seen in patients for a number of different reasons. You can get decreased protein levels in our bloodstream. Water and fluids follow proteins, that's that osmotic pressure. So if you have reduced protein levels in your blood, the water can kind of seep out into the tissues, and you can get swelling. A lot of times it's more of that dependent swelling, or even swelling up into the abdomen or trunk. That's called hypoalbuminemia, if you've ever heard that term. But decreased protein levels, certainly in people that have poor appetite, nausea, diarrhea, those low protein levels can be, they can definitely affect that peripheral swelling. And then there is reduced physical activity. If those tiny lymph vessels, they don't have that heart pump regulating the flow. The lymph vessels actually depend greatly on muscle movement, muscle pumping action of the legs, of the arms. So that's why we do often talk, and I will talk further about activity and how important it is in helping lymphatic flow. Then there's blockage of the lymphatic return, removal of lymph nodes, scarring from surgeries. Those can affect lymphedema. Obesity places the general population at risk for swelling. And in patients with lymphedema, it's extra pressure on that lymph system to bring that fluid upstream. So we talk about that as well. And then certain medications can cause swelling. Certain heart medications can cause fluid retention. Certain drugs like metformin for diabetes can cause fluid retention. Even not as commonly, but some of the nerve pain drugs we've seen also contribute to swelling. So it's important to kind of go through medications as well with your doctor when, if you do develop swelling, to consider that. So Definition of lymphedema: it's the abnormal accumulation of tissue fluid caused by an abnormality within the lymphatic system. This can lead to chronic inflammation and changes in the skin. It can be progressive, and treatment is more effective if we catch it early. There is a lifetime risk after lymph node removal and surgery and treatment for developing lymphedema. And there is currently not a cure, but a lot of treatment options. So early signs of lymphedema, what to think about and look for after cancer surgery and treatment. Limb fatigue. Legs and the abdomen, pelvic region can feel full or aching. You can note some tingling in the tissues with swelling and lymphedema. When you're looking at your legs and your ankles and your feet and your toes, you can lose some of those anatomical landmarks, so your veins might not be as pronounced. The bony regions like your ankle can not be as prominent anymore. And veins in the legs, things like that can start looking different places where this fluid can kind of sneak up. So it is good to kind of keep an eye, a general lookout for these symptoms. But again, sometimes people just feel heaviness first. It's kind of like we use the analogy of like a sponge. If you have a dry sponge and a wet sponge, they may look exactly the same, but that wet sponge is a lot heavier. And so initially that can be that first symptom of heaviness and fullness. So what happens when you have cancer treatment and how it affects the lymph system? It can be caused by the cancer itself. Sometimes that's the first symptom of cancer. It can be swelling in a limb because the lymph nodes are blocked by the cancer itself. Surgeries to remove the cancer often include removal of local lymph nodes. And then also surgery itself can lead to formation of scar tissue that can affect lymph travel. So we call it kind of like road construction. That tissue changes, the lymph vessels and the lymph fluid isn't able to flow through that. So we talk about rerouting the lymph flow. The other thing that a lot of times happens with treatment of ovarian cancer is radiation therapy to the pelvic region, and that can cause tissue changes as well, damage to lymph vessels, but also just general soft tissue changes, fibrosis, again, road construction for lymph flow. This is some data, some numbers about the risk of developing lymphedema, but these numbers may be actually higher than what they really are because the data included just swelling in general, and I don't believe that they were looking at all the other contributing factors that can go into swelling. But again, you can see here the numbers there. Vulvar cancer is the highest risk because they generally remove the groin lymph nodes, and there are fewer lymph nodes in the groin. And because they're legs, the legs take the brunt of a lot of the gravity, a lot of the pressure in our body. So it's a higher risk for swelling in the legs, particularly after that surgery. Ovarian cancer, 7%. Uterus cancer, 18%. So possible affected areas after gynecological cancer treatment: feet, ankles, lower legs, thighs, groin, labia, mons pubis. A lot of people don't ask. When you're in your appointment with your oncology provider or your general practitioner, they might not all the time ask you about these areas. Or they might not look every time you see that physician as well. So it is important to bring it up if you notice any swelling in these areas because there is treatment available. Buttocks and hips to the side here and up in the back there, that upper thigh area, that can be a trouble spot. And then also the lower abdomen. So this is a point that I wanted to bring up, that gynecological cancer survivors actually have a higher rate of venous disease than lymphedema. So in the general population, vein reflux or venous insufficiency is present in about 40% of people, and it's more common in women. So again, that's important. Some people may be aware of this before they go through their cancer treatment. Some people may have had, some mild swelling after a long day, that gathered at their ankles that would improve with, elevation at night or sleep overnight. Some of that swelling might go away. So it's never been a huge problem, but they, or other women have had varicose veins treated, pregnancy. A lot of people develop varicose veins during pregnancy and they don't go away. And so it is common, but again, may not have been as big of a problem or an issue. But then after cancer treatment, swelling, it is worth considering that as a possible contributing factor. The other thing is that the risk of blood clots is higher in patients with active cancer. A lot of inflammatory factors going on while you have active cancer and during cancer treatment itself. Some medications can place you at higher risk of developing blood clots. Right after surgery, in general, patients are at higher risk for blood clots. That's why they have those pumps on your legs right after surgery. That's why they're really trying to get you up out of bed as soon as possible to prevent blood clots. But it is something that we have to consider if you develop, the initial onset of swelling. We do want to consider that in our workup. Some people after gynecological cancer have been found to have pelvic vein compression right after treatment. And so if the usual causes, if you've gone through, workup for the legs, Dopplers of the legs, or some other tests that we can talk about, if they're coming up normal and there's still concern, sometimes your provider may decide to look in your pelvis region. The other thing that can happen is that radiation can change some of the veins in your pelvis. They can cause the veins to kind of stiffen up or be more narrow, and so that is a consideration. It is not where we go all the time, but it is a possibility. And so again, if we're kind of confused and are not sure what is causing the new onset of swelling, we may look in that pelvic region there. Blood clots, once they do happen in the legs, can cause damage to the vein vessel itself. The blood clot kind of, causes blood to kind of be stuck in that vein, and that can cause inflammation and changes to the vein wall that may make that vein weaker over time. And so, again, that's something that we look into with different tests and treatment strategies. So again, this slide goes over diagnostic tests. Oftentimes, mild new onset swelling after cancer treatment, we can kind of diagnose that on the physical exam and can be managed clinically. When we don't know the exact reason of the swelling, or we're trying to sort through what could be the contributing factors, there may be additional tests that we do order. This may include a lymphoscintigraphy, and that's a study that looks specifically at the lymph vessels. Lymph vessels carry protein, and so they're able to inject a protein and attached to a dye, and it's a nuclear medicine test. Anyway, so that protein is carried up through the lymph vessels and the lymph nodes, and so we're able to actually see them on the study. Again, a venous insufficiency study. It's an ultrasound of the legs while you're standing up or on a tilt table. It's different than just getting a plain ultrasound while you're, laying on a table. They're actually looking at the veins while there's gravity and blood flow happening, and looking for any valves or any weakness or dilation or changes in the vein wall. So, but again, that's an easy enough study to do. It's not painful. And then again, if there are concerns about possible proximal changes or changes in the abdomen or pelvis, we might do a CT scan, venography that looks at the vein, the blood flow in the veins and the arteries in the pelvis. And then looking for other contributing factors like reviewing medications, going over other medical conditions. We may also do some lab work too. So does anyone have any questions so far about kind of what lymphedema is and the diagnosis? Yes?
The lymphoscintigraphy,
yes.
Is that done very often?
We do it often in our program because we like to know what it is that we're treating, and we like to have a clear picture. It helps us explain the treatment strategies and the prognosis and to the patients, and so we find it a very helpful tool. Not every radiology center will offer lymphoscintigraphy. It does take some extra training that not all radiologists have had. So even, we see patients in a number of different clinics through the metro, and we still have patients have that test done at Abbott. But I don't know about like the university or other healthcare systems that might offer that test. So I would certainly ask your providers for it. And again, we might not always need it, but if it's significant enough, then we think it's going to help us. We certainly will order that study. Good? Okay. So recommendations for reducing your risk of lymphedema. Regular follow-up appointments with your medical professionals. Your oncologists and your surgeons are aware of lymphedema, but there are also specialized professionals that have extended knowledge in lymphedema that you can follow up with. Report those changes in size and sensation, skin color changes, temperature, anything. Just report them. Tell your physician about them or your provider, and getting that early help. Maintaining normal recommended body weight. That is important, and it's beneficial for reducing your risk of lymphedema. And again, in the general population, like I said, weight gain and obesity can affect edema itself. So we do talk about activity later on today. So skincare, it's really important to take good care of your skin, prevent cracking and skin breakdown. So when you are at risk of lymphedema, you've had reduced lymph nodes, your body has the reduced ability to kind of trap infection. So, our lymph nodes, their job is kind of to trap that bacteria to try to prevent it from going into the bloodstream, making more of a systemic infection. So when you are, trying to reduce your risk of infection, we really want you to take good care of your skin with good lotion, good plain lotion on a daily basis. Can really help keep that number one barrier intact and help reduce your risk of further complications. Try not to use lotions that contain fragrance or dyes, because that fragrance is actually just alcohols. So it really can just dry your skin out more. So I don't know how Bath and Body Works is done. So anyway, we recommend Vanicream, Eucerin, Cetaphil, just light, lotions. Eucerin can kind of be creamy or thick. Cetaphil is great. It's really light. So this is generally what we use in our clinics that people tolerate well. Protect the affected area or the area at risk from trauma. Avoiding constriction from clothing, ill-fitting clothing, jewelry. Keep an eye out for jewelry. Avoid going barefoot if the feet can get cut. Using common sense. The guidelines used to be a lot more strict, and we're trying to kind of ease up a little bit and letting you use common sense. So if you're going on a hike in a really wooded area, up north, it might be good to wear slacks and, not wear shorts, just to ease your mind a little bit. But again, wear shorts if it's a really good day and, you want to be outside and it's warm out. Shaving, if there's reduced sensation in that area, be very vigilant in using your eyes or using a mirror in areas that don't have sensation. Under the arms, we tell people, use a mirror, go in front of the mirror. If you can't feel under that area, be careful, but we're not going to tell you not to shave. And that's the same in the groin area, going with the grain, not going against the grain, of hair and skin cells, kind of being aware and gentle. Using, the same thing like with gardening and things like that. Be outside, have fun, but if you know that there's going to be an at-risk, if you're at risk for getting a cut or a scrape, maybe use protective clothing. If there is a break in the skin, wash the area with soap and water and apply a triple antibiotic ointment. Neosporin, there's a lot of people that actually don't tolerate Neosporin, but bacitracin, generic triple antibiotics are just fine. Watch the area closely. So not every scrape or cut or nick is going to lead to a problem, but just watch the area closely. If it becomes pink, red, hot, painful, we want you to see a healthcare professional that same day because the risk of that infection spreading is higher. And we want to get the inflammation down, get the infectious process resolved as quickly as we can. Because again, inflammation can bring about fluid, extra fluid, and that can stress the lymph system. So we're going to just try to treat any infection or wound as quickly as we can. Travel, again, this is another controversial area about this theoretical risk that flying in an airplane can cause lymphedema or place people at increased risk. In general, people are at risk for swelling when they're not moving. And that's what happens in an airplane when you're sitting still for a couple of hours or more. People tend to have fluid stasis. Their muscles aren't working, so people get swelling in the ankles. That can happen if you've had cancer treatment or not. That fluid stasis leads to swelling, can lead to blood clots. So in the general population, we recommend getting up, moving at least once while you're seated, doing some ankle pumps to get that blood flowing. There's the idea that reduced cabin pressure, that gravity against our tissues is reduced, so that can lead to swelling, lowered oxygen levels, and then dehydration, just a change in your day. You're stressed, you're moving, you're reaching, you're carrying. Those kind of things can place extra stress on your body. So what do we say? We say move around, change the position, maintain good hydration throughout the flight, and good diet. Maybe avoid the, salty peanuts or something like that. In general, we don't talk a lot about salt restriction with lymphedema. It doesn't necessarily affect it, but we're just trying to look at the whole picture. What makes people swell? So again, those are some good suggestions. Maybe have your significant other carry the heavy trunk. I don't know. What is it called? Suitcase. Wow. Yeah. Okay. Yeah. Pregnancy brain, mommy brain, kilo brain. Very significant things. Okay. So controversies where this happens is people want to know, should they wear a compression stocking while they're traveling? Now, if you are at risk for lymphedema but have not had lymphedema yet, there is not really good evidence to suggest that wearing a compression garment will reduce your risk of developing lymphedema. There have actually been some studies that have shown that wearing a compression garment that's ill-fitting could actually increase your risk. For patients that have had gynecological cancers, again, there might be other contributing factors that make you swell more in general. It might be a good idea to consider a compression stocking. But just because you have the risk of developing lymphedema after cancer treatment itself, the National Lymphedema Network, the medical board providers there, the website is at the end of my presentation there. They are not saying that you should or should not wear a compression garment, that it's really a personal choice based, having a conversation between you and your provider, really weighing the costs and benefits between you is a really good idea to have that open discussion, that it's a personal decision. If you do decide to wear compression stockings during air travel, it's recommended to work with a reputable compression garment fitter to make sure that you have a compression stocking that fits you well. They can be snug, and you don't want it to be too snug, and you don't want it to cut off the circulation at the top of the thigh or at the top of the calf. You really want to make sure that it fits you well, because again, if it's too tight, it's going to create a tourniquet, and it could make the situation worse. So, especially for the initial fitting, I would recommend working with a compression garment fitter, and there are multiple good fitters around the metro area here. Exercise. So there are at least 20 studies now that have shown that physically active cancer survivors have a lower risk of cancer recurrence compared to inactive cancer survivors. Additionally, studies have shown that cancer survivors who become physically fit have reduced cancer-specific mortality and all causes of mortality. Exercise is an important way to improve lymphatic circulation by stimulating that muscle pump action and by deep breathing. So when starting or returning to exercise after cancer surgery, it is always important to start slowly. Too much activity too soon can overwhelm the body. So what happens is, you're increasing your heart rate, you're increasing your muscle action by maybe some repetitive action. That increased blood flow will relate to increased lymphatic load, increased fluid that the lymph system is also in charge of. So that can be overwhelming initially. So what we say is we start low and go slow. It applies to gardening, sewing, typing, yard work, walks, lifting weights, a lot of anything that really gets your heart rate up or is a lot of repetitive action. Right after surgery, follow your surgeon's recommendations. They'll typically have kind of a week limit or, a time period to say, okay, take it easy, and then, gradually say, okay, you're free to do what you want to do. Some people have drains in place right after their surgery. We typically recommend to take it really easy while the drains are in place. But again, follow your surgeon's recommendations. Typically, physical therapists are good about knowing general surgical recommendations. Often after gynecological surgery, the core abdominal muscle strength is weakened and sore. So again, we recommend, or it can be very helpful to work with a physical therapist to start strengthening exercises for that core. So not just going into a straight sit-up, but really engaging these deep pelvic floor muscles to help reduce pain, to help improve your stability and your posture, and that can help prevent, increased tension on other muscles like your back or your upper back or your neck that may be taking the brunt after you've had surgery. All of us kind of naturally protect that area after surgery, and we can get these poor body mechanics. So we really focus initially on helping you regain some of that core or body strength there. And then, again, getting guidance into starting aerobic activity. So when you're starting activities, take frequent breaks. Try not to get overheated. In the summer, very quick to get overheated, and that heat and humidity, it will come. And, we want to be aware, starting into the warmer months, what kind of activities we're doing and taking it easy and taking breaks, drinking plenty of water, staying hydrated, advancing the exercise program slowly. And again, you can start it at home. Go up and down the steps once, and then add twice. Walking around the house, doing laps, getting an exercise DVD, using a Wii Fit. There's different programs at your local gyms, a walking club. The sky's the limit. Yoga, Tai Chi, these are incorporating deep breathing techniques, large motor body stretches and techniques that really can be beneficial for lymphedema reduction, and just it improves lymphatic flow. Swimming is a very good exercise to do, especially if you do have lymphedema. Being in the water actually gives some compression against the tissues, so people can actually tolerate swimming, and their legs or their arms can feel better after being in the water. So what if you develop lymphedema? What do we do? There is a strategy called manual lymphatic drainage. It's performed by a certified lymphedema therapist. Those are most often physical therapists, but there are occupational therapists as well that know how to do this. Some massage therapists in the community may have had some training in manual lymphatic drainage as well. So what it is, because those lymph vessels are so superficial, there is a skin stretch technique that's done in a direct sequence that opens and engages intact lymph nodes in our body and kind of encourages the lymph flow of the affected area to move towards the intact lymph nodes. Again, it just feels like a really nice massage, just a really light massage. So that's one part. If there's significant swelling, we will use compression. And initially, we use a multiple layer system that they look like ACE wraps, but they have less, an ACE wrap, you can kind of still stretch it out pretty well. These wraps are more rigid. They don't allow as much give. Usually, they're placed over like a light gauze padding on the leg. And they're worn initially for 22 hours out of the day, 22, 23 hours daily. And they're changed daily. During that first phase of treatment, we typically have patients see the lymphedema therapist twice a week, 3 times a week. A lot of our research actually was done over in Europe, where they would have the patients in the hospital and they would have daily treatments with a lymphedema therapist and daily bandages and manual lymphatic drainage for like 2-3 weeks daily. Most of the time we can't do that. Our therapies are outpatient based, so 2 to 3 times a week is ideal. And then the therapist also teaches you exercises, so different stretches, with our upper body, our neck, our legs, and then deep breathing exercises that again improve that lymphatic circulation.
One other thing you could do for compression therapy, which I switched to because the wraps kept falling down, are these Velcro wraps.
Yes.
They're
yes.
just great. I wear them up to my knees only, and they've made a terrific.
Yes, in some patients that either may have things that are that interfere with that normal bandaging therapy, either they have balance deficits or they, it's a technique to learn how to apply the bandages yourself. It can be done, but it is hard. Or a caregiver, usually we highly recommend having a caregiver or a family member or a friend come learn the technique in our clinics and help patients with it. But if all those things aren't happening, or it's just, it's difficult to go on with bandages, there are some studies that show that these Velcro compression garments that are adjustable can be just as effective as the bandages. And again, it's something that you and your lymphedema therapist or your medical provider can discuss. And, there's disadvantages to them as well. I mean, they are bulky. They're not maybe quite as bulky as the bandages, but they're still, something that people might not like. And so there are pluses and minuses to them. But certainly it's a good option. Yes, so thanks for mentioning that. So phase 1 treatment includes that compression therapy, the manual lymphatic drainage, and the lymphatic exercises. Typically the best results are seen within the first 2 to 3 weeks. So, typically therapists are taking measurements on a regular basis to kind of watch the volume reduction. And then after that first 2-3 weeks, then we move on to the phase 2 of treatment. And this is where it can be really tricky and frustrating. We transition into compression garments. And that may include both daytime and nighttime garments. And then and there are a lot of different options. There are custom compression garments, and they are personally made just for you in the areas that you need them, and different compression levels. So it's very personalized from patient to patient. It's not going to be the same for everyone. And then there are daily self-manual lymphatic drainage techniques. The therapist will teach you how to do lymph drainage on yourself, or they can teach a significant other. There are exercises, and then there's also the sequential pumps that look like a big leg sleeve. They can have the core component that goes over the abdomen, and what that pump does, it kind of stimulates the lymphatic drainage. And usually that pump is used daily initially, and it's about an hour long, sometimes an hour and a half, depending on the sequence that the provider prescribes. Some people I eventually know that maybe use it 2-3 times a week. It is a time commitment. So patients a lot of times they use it as a modality, a couple times a week or as needed. Some people find significant improvement. Some people say it helps maintain. So it can be used in a number of different ways there.
But, excuse me.
Yes.
But these treatments don't fix it. I mean, it doesn't get cured. You're going to live with that?
Correct. Yeah. And so we hope to...
And it's a lymph node, or several, or does it does it progress? Is what
what can happen, so the number of lymph nodes removed may or may not impact your risk of lymphedema. And we see it in upper extremity and lower extremity that for whatever reason it seemed to be the straw that broke the camel's back, it happened to be an important lymph tract for your leg. And again, that's why it's hard for us as providers to say what your risk is going to be as a lifetime, depending on your surgery. But we try to give general ideas. Lymph node removal, radiation therapy can add a significant amount of risk if you've had pelvic radiation. But we have patients that have not had radiation that get lymphedema as well. So it's hard. A lot of the times over the first year is when we see a lot of lymphedemas start and can progress over the first year. But then I've also met patients that went on for a number of years and then maybe had an infection or a surgery, like a knee replacement or something, and then that was what broke the camel's, that was the final straw. And the lymph system can adjust. So these lymph vessels right after surgery can kind of find their alternate route to intact lymph nodes. Because there are multiple lymph nodes in the pelvic region that they didn't remove, these vessels, it's kind of like a spider web, they can find their way around. And so for years, they can actually kind of compensate. But over time, carrying that load, they can get stressed. And there can be changes in the lymph vessels. And we see on the lymphoscintigraphy that these vessels are, we don't see them as well anymore. Or there's reflux and pressure in the lower leg or in the groin over time.
Once you get the pressure, that's what causes the pain?
Yeah, it can be that, yes. And just the fluid stasis itself being stuck. And a lot of times, like in the foot or in the ankle, it's a small compartment there. So that can cause a significant amount of discomfort in the ankle or in the foot or the knee. But again, when we're looking at the big picture of what contributes to swelling too, we do look at joints. We do look at mobility and what else is contributing to discomfort in the legs and what could possibly, inflammation in a knee that's, bone on bone, that can cause edema and that can negatively impact swelling. And if you ever need surgery on that affected leg, it would be good to talk to your surgeon about the fact that you are at risk of lymphedema. There are certain things that we try to talk to surgeons about, like reducing tourniquet time or tourniquet pressure, getting compression on the limb early after surgery as much as we can. But again, it's that early treatment that's best. And when we do have swelling and when we do have lymphedema, our goals are to help maintain and help to keep the skin as healthy as possible and prevent chronic changes of lymphedema like the skin hardening and thickening that can become more uncomfortable, prevent infection, wounds, and move forward with activity, exercise, other things that we can help you do to carry on with it and to keep it stable as best as we can. Yes?
I wear compression garment on my right leg up to the thigh, and when I exercise, I never wear it because I can't stand having it on to exercise. Is that good or bad, in your opinion?
For a lot of people, wearing compression during exercise is good because you're getting the muscle pump action against the compression garment and you're getting that extra squeeze up the leg, so that can be helpful. However, I think that once you do have lymphedema, you need to kind of find out what your leg will tolerate. And if your leg can tolerate exercise without compression, I think that that's just fine. So it's kind of coming to terms with yourself and kind of finding out what you can tolerate and what you can do. I mean, we're going to we understand it is not a fun thing to have lymphedema and not a fun thing to wear compression garments every day. So if we can help you kind of think about, okay, can you be out of your compression garment for a wedding? Can you be out of your compression garment to go swimming or to go exercise for an hour? You know, that's what we want to try to talk to you and talk through with you. Mm-hmm. But I did everything right. And that's the very difficult part. And we all know people that took very good care of themselves, healthy, active, ate well, did everything right, and they still got cancer. And it's the same thing with lymphedema. Take great care of yourself, you still get lymphedema. And you know, we're really trying to work through all of the emotions and the facts, and you know, work together to provide the best treatment plan for you individually going forward. Early detection and treatment is best. So not, you know, really being your own advocate, which I know it can be hard, and say, no, I have swelling here. What do I do? Send me to the send me to the specialist. And then again, like I said, finding what works best for you is the most important. So in conclusion, there may be multiple contributing factors that can lead to edema in the patient that's had gynecological cancer. And it's critical to take a total rehab approach. Looking at edema itself in isolation is not necessarily the best thing. We want to look at all the other medical conditions and functional deficits that can come with cancer treatment that could potentially negatively impact your edema control. There are many late effects of cancer treatment that can impact lymphedema management. I just repeated myself, sorry. But numbness and tingling, neuropathy, can affect your ability to take care of your swelling. So we want to address that. Gait and balance. Certainly edema negatively impacts your sensation and your ability to walk and balance. Again, we talk a lot about pelvic floor and core abdominal weakness. It's kind of our new thing. I mean, it affects everyone, no matter what surgery you've had, but certainly after abdominal and pelvic floor surgery, it's a huge thing that, and even in the general public, it's a main contributing factor to low back pain if we're not strong in our core. So we really try to help people kind of grasp a basic program to help improve your abdominal strength. Weight gain, again. Treatments for gynecological cancers. I mean, you're sent into hormonal changes, chemotherapy, steroids with your chemotherapy, so many things that contribute to weight gain that can, affect swelling. And so we kind of walk through that process. I mean, if we're looking at limbs and measuring your legs and you've gained 10 pounds from chemotherapy, well, that's going to affect those numbers. So we have to really kind of think through all of that and say, well, is this lymphedema or is it just general fluid retention because of chemotherapy or weight gain? So really need to sort that out. Again, addressing nutrition, protein levels, low vitamin D can affect a lot of things. A lot of us are deficient in vitamin D. Incontinence, that can really negatively impact your ability to wear compression garments and comfort level and function. So it's important to address all of those things. Thank you so much for listening today. I do want to say again about fitness. We talk about it a lot, and it can be kind of overwhelming and stressful because I think of our society, says fitness means a size 4, running a marathon. That is not what we're talking about. We just want to help you move, and in our program we really want to help that with basic exercises that you can do at home or in the community. And it's important with your lymphedema as well. So just want to say that because I know you've heard it 3 times today and you hear it every day. But I wanted to give that shout out because it's a lot of pressure, I think, to be told all the time to exercise. And just know that there's support with physical therapy and occupational therapy out there. So thank you. Yeah.
So earlier you were saying that you mentioned at some point that salt isn't necessarily something that you talk about, but then you were talking about protein, that you need to have the added a certain protein level.
Right.
So can you talk a little bit about just general diet? Should you shoot for a higher protein level than what the daily recommended is if you're already seeing some of the lymphedema?
Yes, I think, well, it would be good to have a lab drawn to see whether your protein levels are actually low. And then a lot of times oncology offices have dietitians and nutritionists that can help talk about protein, different ways to get protein into your diet, or protein supplements, protein drinks, diet supplements, those kind of things. So it is helpful. What I meant with the salt is that certainly it's good to have salt in moderation, but we never, like in a cardiac situation or someone that has a heart problem, a lot of times I'll talk about like a salt-restricted diet. We don't do that, but we're just trying to say in moderation. But certainly some people know that if they eat a salty diet, they swell a little bit the next day. So it's just kind of taking all of those things into consideration and making a balance, and smart choice about diet choices. But certainly if you, a lot of times protein levels, albumin levels are on your lab work, and if your doctor would say if it is or is not a problem for you, but if certainly you're concerned, it could be part of a workup, and it's an easy thing to check into. It's an easy lab.
Any other questions? Before we close?
Thank you.
Thank you.